This is LiveWell Talk on new Clinician Spotlight. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. Today's episode is another installment in the series on the podcast where we sit down with new clinicians at UnityPoint Health, Cedar Rapids, and get to know them as a clinician and as a person. Our guest on today's episode is Dr. Nicole Gensicke, a vascular surgeon with St. Luke's and Physicians Clinic of Iowa Vascular Surgery Program. Dr. Gensicke, welcome to the podcast.
Thank you so much.
Welcome to the community.
Yeah, thank you.
So
I'm happy to be part of it.
Where are you from?
I'm originally from a small farm town in northwest Iowa called Newell. So if you go to Fort Dodge.
Newell Fonda.
Yes.
Yes, basketball team.
I did not contribute from the athletic perspective, but hey, I created the debate team. So
did you?
Yeah.
Well, good for
the
you.
other end of the spectrum.
Yeah, the state girls tournament was recently, and Newell Fonda's just a staple of that tournament. They go quite often, don't they?
Girls softball, girls basketball,
Really?
They're all amazing.
Yeah. What? Tell us about where you trained and.
Yeah, so a lot of my training was actually just down the road in Iowa City. So I did my undergraduate there. I had a international relations with a focus in Eastern Asian studies, and then also integrated physiology. And then I went on to do my master's in public health at Iowa, and then medical school and residency. So
Wow.
I spent a little time with some study abroad in Beijing, but otherwise, Iowa just kept being consistently the right answer for me.
What was it like studying abroad in China?
It was great. It was absolutely wonderful. My mother is a foreign language teacher as well, so she had done study abroad, and hers was in French and German, but studying abroad was a chance for me to see life just a little bit differently and have a fully immersive experience. And it's definitely shaped a little bit about who I am.
I definitely had no interest in doing that, and I regret it now.
Mm-hmm.
So encourage our children to do that if they so inclined.
Yeah.
Tell me, growing up in Northwest Iowa, how's that influenced how you just perceive patient care and approach the work? I mean, you're probably Dane or Swede, and you're a hard worker because that fits the people up there. But tell us a little bit about how you approach your vascular practice and take care of patients.
Yeah, I think part of what really made vascular kind of the final cinching item for me of this is what I want to do is the patient population. A lot of the patients are older. A lot of them are farmers as well, truckers who have lived sometimes a little bit harder of a life. And those tend to be my people. I really do enjoy just the conversations that coming from it. Being able to talk with a farmer and say, oh yeah, okay, I can have a conversation about a PTO shaft because I have a tractor, and just talk about those types of things. It really solidifies that relationship.
I used to tell my staff, I practiced in Grinnell for almost 6 years, 5.5 years prior to coming here in 2005. And I would say, like, if it was raining and like a farmer would call, I'd say put him on at the end of the day. He can't be in the fields, and that's why he's coming in. But like, if it was like really nice, I'd like say send an ambulance because they will not call if they could be out in the fields, Yeah. No, you're absolutely right. We have some overlap in our clinical practices. Just I staff the wound clinic on Fridays and serve as the medical director, and it's a very grateful patient population when you can help them with those vascular problems, isn't it?
Absolutely. I view vascular a lot as second chances of people just want to be able to walk their daughter down the aisle for a wedding. They want to run around Chicago with their grandkids and not have their grandson say, Grandma, keep up, keep up. So getting those opportunities, those chances, those moments back, that's really what it's about for me.
You're married?
Yep, I am.
And...
I am married to a native Cedar Rapids guy.
Oh, really?
Yes.
And well, he's speaking as a native Cedar Rapids guy. That's just really a feather in your cap on that one. But children?
Yes, I have 2 beautiful children. My son just turned 4. So he's been running around the neighborhood playing with the kids now that the weather is nice and warm. And
Awesome.
Then my daughter is turning 1 in
gosh.
First, just coming up here in April.
Yeah, you can kind of, you're still in man coverage, so you'll have to make that decision whether or not you want to go to zone coverage with a third someday. You ended up here in Cedar Rapids, possibly connected to being from town in Iowa City, and also proximity training and where your husband's from. Did you meet him down at University of Iowa?
We actually met on a ski and snowboard trip associated with University of Iowa. I was still in college, and he had just graduated and was friends with an engineering grad student. And we met out snowboarding, and we ended up, 10 years later after meeting, getting married out in A-Basin. And now he's actually going to be gone next week because we do a lot of volunteering with the community to take some kids out snowboarding that are teenagers here in the community out in Colorado. So
cool.
We kind of switch off who gets to do that one.
Yeah.
But so that's been a big part for us is the community portion of it too. And then also Colorado's been great for us.
What attracted you to UnityPoint and PCI? How did you connect with them?
It was really the collaboration between PCI and UnityPoint that I found so important. It was, important partners. Dr. Lawrence and Dr. Cray have been great mentors, but also just coworkers as well that I can have an easy, normal conversation with. But then also at UnityPoint, the amount of services that were available. Your work with the wound clinic is extremely important for vascular patients to be able to come to one place and get everything done without being shuffled around so much. So that was important.
If you could, I think I have this conversation with Dr. Cray all the time. I mean, to a certain degree, Dr. Lawrence as well. So much peripheral vascular disease is undiagnosed.
Yes.
Because people curtail their activities to fit their discomfort. So they really don't know that their legs hurt. They just don't walk as much as they used to, right? So what is one message you could send out? Maybe not so much to listeners, but definitely to listeners, but also maybe primary care physicians about vascular disease and its treatment.
Yeah. So one of the major things that I would throw out there for is that, very often individuals are told, oh, well, you're just slowing down, you're getting a little bit older. And to just accept that point blank, I kind of rear my head up a little bit because there are things that we can do often enough, or at least should be looked into before accepting that, oh, this is just the way it is. Especially for individuals who have smoked, the older population especially, this was something that was normal. We didn't know it was a bad thing initially. I mean, smoking was at one point, there were physicians who said, oh, it was better for your asthma.
Yeah, asthma cigarettes from the
know.
1920s and 30s, yeah.
And I would say for especially those individuals, peripheral vascular disease is far more prominent with it, men and women. It actually affects women, more undiagnosed women than men with the disease for it. And what it tends to be is that you try to walk and your legs cramp up on you. It's not the joints, it's not the ankles. It's like the muscles feel like you're getting a Charlie horse. You have to sit and wait. And usually that's when the grandkid is running ahead and you just want to catch up with them, or you just want to finish your grocery shopping and you can't do it without taking a break. That's the time to at least go into your primary care physician and get it checked out, or say, hey, this just isn't right. So being an advocate for your own health and not just accepting that, oh, I'm getting old. No, there's things that we can still do. Medicine's come a long way, and if we can help, we want to help.
Now, you're talking about the arterial flow in the arteries, but also venous disease in the lower extremity certainly contributes a lot to what I see out at the wound clinic, but also to varicose veins, et cetera. Tell us a little bit about services you provide regarding venous disease.
Yeah, venous disease is actually a very exciting area. We've come a long ways in the last 20, 30 years. Before it was big incisions, stripping out the vein, stay in the hospital overnight. Now it's a very relatively straightforward procedure that can be done in 20 to 30 minutes in our office. You don't necessarily have to come into the hospital for it. And the amount of benefit that people get from it, and this actually tends to be a younger population, genetic predisposition, and then also women after having babies causes those veins to blow out with it. And you just get to the point where you accept, oh, my legs just kind of hurt. They're kind of swollen. But really getting that fixed, it lets people last longer throughout the day. If they don't feel like they have to go home and put their feet up, they can go run around with the kids. They get a lot of value back from their legs, not feeling like they're just constantly aching. And it can lead to some very, very severe wounds. One gentleman I took care of actually required bilateral amputations because the venous wounds were never addressed, which was sad.
And I always, that high blood pressure that's created in the veins in the venous system, causes a hydrostatic pressure back on the wound. And I always tell patients, running water doesn't freeze. As long as that pressure's there, you're not going to heal this wound. And it is pretty amazing how quickly they can heal after you fix a venous issue. That's always very rewarding.
Yeah, I've seen people go a year long with a wound that just won't heal, and it takes it out of a person to be constantly trying to take care of it. You do the venous procedure, you treat the perforator, it's healed in a month.
the 5-year survival is less with a venous wound than a heart attack.
Yeah.
Which is, I don't think a lot of people put the 2 and 2 together,
No.
but that's kind of worrisome. You talked about snowboarding.
Mm-hmm.
What else do you do for fun?
Since I have been out of training, it's been, kind of a new lease on getting time back with my life a little bit more. I mean, I love being busy, but, I also have a lot more time to spend with my children as well, running around, playing with them, be able to take the kids on walks now that it's nice and warm. But then as the season changes, as we get closer to fall, my family as well has an apple orchard here in town. So that'll shift my gears a little bit to that with free time. And it won't be uncommon to do a fem pop one day in the morning and then go hop on the tractor in the evening. And it lets me get my fingernails a little bit of dirt underneath them and stay true to who I am as well.
Did you ever think growing up that you'd be working in an apple orchard after medical school?
I thought I left my farm town to come here, which is, is a big city compared to a town of 900.
Yeah.
Just to end up with multiple tractors. But I'm happy about it. I think it gives me something to do outside, and I love that. Keeps me connected to nature.
What tractors do you guys have?
A couple John Deere for it as well. It's usually what I'm in. The cabbed one is nicer if you got one of the kiddos and whatnot, because I'm not going to let one of my kids on one of the uncabbed tractors, but they can sit in the lap and carefully go 2 to 3 miles per hour while we're going down the Berries Run or whatnot.
I just, side note, I think the Alice Chalmers are kind of cool looking. I'd like to have one. Well, what else would you like listeners to know about you?
I guess the main thing I'd like them to know about you or about me is that, even if you have a concern and, the concern is, hey, my legs do hurt, sometimes I find out that, I see a person and they don't end up having a vascular problem. That is not a wasted visit.
No.
That is a visit where we're figuring out what's going on. And I am happy to see people to try to figure out what it is. And even if we're checking off the boxes of, hey, this isn't vascular, it could be this instead, will help steer you to the right point. Absolutely. The end goal is always, always, always going to be making people feel better, healing wounds, improving quality of life. And that looks different for everyone. And what the problem is different for everyone.
I always say tell patients, we make a list of what it could be, and we start crossing it off. And so, we'll have a good list of what it's not, and we'll figure out eventually. The bird always sings eventually, is the phrase, I believe. So. Well, Dr. Gensicke, thank you for joining me. This has been a real pleasure to get to know you. It was fun to know a little bit about you and not more than just a crusty vascular surgeon like Lawrence and Cray. So we're glad you're here with us and glad you're on the medical staff. Once again, this was Dr. Nicole Gensicke, a vascular surgeon with St. Luke's and Physicians Clinic of Iowa Vascular Surgery Program. If you're experiencing issues with veins or arteries, you may call 319-368-8346 to schedule an appointment with Dr. Gensicke. That is 319-368-8346. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.